everyone, it's Dr. Hodges and my counterpart. This is Kitty Cat Margie Ruth and Eddie the bear. And tonight I was going to talk a little bit about Obesity Care Week, and today's topic is going to be on obesity care and obesity management. And so today is the day that we celebrate and we actually try to educate everybody on how to get care for your weight issues. And you know what I don't think a lot of people understand is that you don't have to be 600 pounds to get treated for your weight. Actually, if you just have a BMI over 25, a normal BMI is between 18 and 24. Once your BMI is over 24, that's actually the time when you're a healthcare professional, your PCP, so family practice doctor, general practitioner, internist, cardiologist, that's when they're supposed to be talking to you about your weight. Once you generally have a BMI over 30, particularly if you have any issues with high blood pressure, diabetes, you are actually a surgical candidate for your weight. Now, doesn't mean that insurance will always cover surgery for you at that BMI, but definitely you're definitely going to be a candidate. Once you have a BMI over 35, that is certainly whenever insurance will typically cover weight loss surgery. But you know, I think there's so much more to your weight and weight management than just surgery or maybe taking a medication. I mean, it is learning the diet. So learning what to eat, learning good things to eat, right, baby?
I like strawberries and blueberries and broccoli.
See, that's all
and
fantastic.
Carrots.
And carrots. See, those are all really good things to be eating. There's also the behavioral component that really needs to be addressed as well.
And I thought the cherry medicine.
Oh, yeah, cherry medicine. That's right. You take cherry medicine whenever you're not feeling well, huh?
Yeah.
So it's more than, like I said, more than just medication, and it's more than just surgery. It's the whole picture. You know, and I think another aspect of weight management that patients don't always think about, or the public always thinks about, is all of the non-scale victories, as we like to call them, or all the non-scale components or benefits that patients will get whenever they lose weight. For instance, if you just have a 10% reduction in your weight, so for instance, if you have 100 excess pounds, if you lose 10 pounds, which is 10%, you can have about a 10 to 12 point decrease in your systolic blood pressure. That's the number on top. You can also have a significant impact on...
That's the goal.
That is the goal. You can also have a significant impact on your glucose or your hemoglobin A1C for all those diabetics out there. It can also have a significant impact on your hormonal axis. That's right. That's right. So you don't necessarily have to lose 20, 30, 50, 100 pounds to have a really big impact on your overall health. So just a dabble do you. So for anybody that's out there struggling with different health problems, high blood pressure, diabetes, sleep apnea, infertility, even a modest amount of weight loss can certainly help control these health problems. Yep. And so if you're someone that is struggling with their weight, if you have a loved one or you have a good friend that seems to be struggling, encourage them to talk about their weight with their doctor. If they're having any, some resistance, or if they feel a little uneasy, please go online. Look up ASMBS. Look up bariatric surgeons. Look up...
Mama, like you said bear.
Oh, yeah. I was talking about your Mr. Eddie Bear. So use the internet to your advantage to look up some of the different weight loss management doctors in your area. I would really recommend that you try to go maybe to a weight loss specialist as a good starting point. That way you can get the whole total picture. If you want to find out more information, please go to obesitycareweek.org. This is Obesity Care Week 2020. There's a lot of really good information at that website. If you click on resources on the website,
That's
You-
the goal.
That's the goal. You're going to find out a lot of good information. They have a lot of different brochures. There's a lot of information on statistics and also on every one of the topics that we'll be discussing this week. So I hope that you guys found this very helpful. If you did, please share this with everybody that you know. Also, don't forget to subscribe and give us a thumbs up.
That's the goal.
That's right. You want to tell them, give us a thumbs up?
Okay.
Thumbs up. Thumbs up. Yay! Have a good night.
Bye.